Are you shifted? Hips over to the side. This is commonly a disc herniation or disc related issue where some people will quite literally just like be walking around and they'll be stuck to the side and they can't figure out how to get straight again. So we're gonna straighten out Julie today. There's a very simple exercise you can do called a side glide. Pretend that this is a wall. I'm gonna pull it up so it looks like one, okay? And what you're gonna do is you're gonna lean into it. Let's actually bring the arm down against the side like this. So let's say if your hips are shifted to the left, as you see, we want to lean with our right side against the wall. What you're going to do is you're going to push that right hip into the wall because you can see hips are shifted to the left. Let's unshift it and even overcompensate. If you can only go a little bit, that's okay. You want to go as far as you can without discomfort. Okay, so we push, 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 push until we hit a barrier of resistance and then back off. Push, push, push. This should be okay. If this is increasing sciatica or symptoms in the leg, then we need to talk. You need some specific guidance. Sometimes that can happen. So you want to do this very gently and only to the point of resistance. This might be something you do throughout the day. The number of times you do it really just depends on the individual, but this is slowly correcting that shift over time. There's a few progressions we can do. You can move the feet further away from the wall to get even further distance, you know, like that, so we can push even further. Now there's further distance to go. But as we go through the right progressions over time, what you'll notice is, as we come out of it and gently set this wall down, you might notice you're a little bit more upright, a little bit less shifted. That disc is in a better position, that low back is in a better position. And now we load you and we keep everything right over time. We keep this going. So if you have a shift issue, start to try this movement out.